Hi, Jacob. Can you give me a quick update on Mrs. Bennett in room 14? I just saw her chart.
Sure, Mihira. I've been with her all morning. Her main complaint is still the discomfort from the rash. She initially thought it was a simple allergy to a new soap, but it has developed into more of a blistering, weeping condition, which is what the doctor wants to focus on. She's been a little agitated about the whole thing, understandably.
I saw that note about a possible skin irritation. Was there anything about her recent trip? I remember she was away last week.
Yes, she was in the countryside. She mentioned walking through some bushes, and then a few hours later, her skin started to get red. She put some calamine lotion on it herself, which didn't help. The doctor is considering a diagnosis of contact dermatitis, possibly from a plant like poison ivy. It's a bit of a puzzle.
That's what I was thinking. So, the blistered skin isn't just a simple allergic reaction then? It's a specific kind of inflammation. That needs to be monitored closely. I'll make sure the records reflect that.
Exactly, Mihira. I've noted down the doctor's plan to use a topical corticosteroid cream to redress the area twice a day. He's also put in an order for an oral antihistamine to help with the itchiness, but the priority is clearly managing the skin's surface inflammation. The patient herself keeps talking about her stress levels affecting her skin, but it seems more directly related to her exposure.
Perfect. Let's make sure the next shift understands that it's not a stress rash.
Mihira, I understand that seeing a bruise appear can be worrying, and I want to reassure you about what's happening in your body. A bruise is simply a very common sign of minor, localized trauma beneath the skin. Think of it as a small, contained spill of blood from tiny, delicate blood vessels called capillaries, which can happen from a bump or pressure you might not even remember. When these vessels break, a small amount of blood leaks into the surrounding tissues, which is what causes that familiar black and blue or purplish color you see. It is your body's natural and even expected response to a minor injury. The most important thing to know is that your body is already hard at work healing it. The color change you will see over the coming days, shifting to greens and yellows, is a beautiful and positive sign that your body is efficiently breaking down and reabsorbing that old blood. Mihira, this is a process that reliably happens on its own, and most bruises fade away completely within a week or two without any need for medical intervention. To help this process along and to ease any tenderness, you can gently apply a cold compress for the first day to reduce swelling, and after that, a warm compress can encourage circulation to help clear the bruise more quickly. Please be kind to yourself and know that this is a normal, self-limiting event, and it does not indicate anything serious. Your body is perfectly designed to handle this, and it will quietly resolve in its own time.